Hello, I'm Dr. John Milne, CEO for OptumSurgical. Here with Dr. John Vallivas, who's the Chief Surgical Officer for OptumSurgical, as well as the founder of the Robotic Knee Institute. We're here to talk to you a little bit today about partial knee resurfacing and why this might be an important procedure for your employees and who are potentially suffering from osteoarthritis. Osteoarthritis is one of the most common diseases to afflict people in the United States, particularly as we age. What's kind of the incidence of osteoarthritis in populations here in the United States and in Canada?
Osteoarthritis, specifically of the knee, is very common. The baby boomer population is going to see an explosion of knee arthritis, as well as other medical issues as patients and people age, but still want to maintain their work status, return to work after injuries, and not be debilitated in any way. And we want to offer the latest advances to get people back to work as soon as possible.
So based on CDC data, we estimate there's probably somewhere in the neighborhood of 25 to 30 million patients who suffer from symptomatic knee arthritis in the United States and Canada combined. So as you look at that population, that's a significant percentage potentially of your workforce as a self-insured employer, increases risks of absenteeism, increases risk of long-term health consequences for your employees, and oftentimes these are the employees who are the most productive in your workforce, that 55 to 60-year-old who is at the peak of their career and peak of their productivity. So John, talk a little bit about if an employer has someone who is suffering from knee arthritis, how could a partial knee resurfacing get them back to work sooner than if they'd gotten a total knee replacement, or how it could reduce absenteeism over, say, conventional therapy with ibuprofen or steroid injections of the knee?
Sure. Arthritis is getting more and more common, and typically primary care doctors as well as orthopedic surgeons have told the younger patients and people who are working that they're too young to have a knee replacement. The partial knee replacement's been around for decades, but it really hasn't been used very much because of a higher incidence of failure because of inaccuracy. The implant is so small that any minor inaccuracy in the placement at the time of surgery can lead to catastrophic failure at an earlier time. So because of earlier failures, traditionally, it hasn't really been offered to younger patients, especially working population. But now with robotic assisted surgery, a new technology that is improving our accuracy and precision to unheard of heights, we're now able to offer this to younger and younger people and get them back to work with no activity restrictions whatsoever. They can run, jump, work, squat down, and return to work much faster with a much more stable knee and a much more well-functioning knee, rather than limping around on pain medications or waiting until they have devastating arthritis and need a total knee replacement, which will take them out of the workforce for months and months.
So as you can see, this type of a procedure could significantly reduce your absenteeism, reduce your return to work time if you're able to offer this to your employees. It's much like using a CNC precision milling machine to really accurately remove exactly the diseased portion of the cartilage and the bone while preserving as much of the natural knee as possible, correct?
Right, so younger patients typically wear out one side of the knee before the other side of the knee. And before letting the entire knee degenerate and requiring a total knee replacement surgery, or just limping around on a lot of pain medications and having a lot of dysfunction, we can now intervene at a much earlier stage and just remove the worn out portion of the knee with this precision bone milling technique on a robot. Because of the accuracy, every case comes out well. The patients do not need a hospital whatsoever. It is an outpatient procedure, and return to work is much faster.
So at OptumSurgical, we offer a bundled payment structure for employers who are paying for their employees to have this procedure done and offer it as part of their health benefit package. Overall, it reduces the total cost of this procedure in comparison to a hospital-based procedure that you might have in your local community. But plus, it also gives access to Dr. Vallivas, who is the premier robotic surgeon in orthopedics in the United States and Canada, has done more of these procedures than anyone else in the world. So we invite you to learn more about our procedure at OptumSurgical.com and the Robotic Knee Institute.